Hey everybody, this is Mike from Fight to Be Fit Health and Rehab here in Dover. Today we're going to talk about the third way that we here at Fight to Be Fit measure whether or not a training program is effective or not for an individual. And it is based off of cardiac output, which is, simply put, how much blood your heart is pumping every minute. Your cardiac output is based off of something called your stroke volume, which is how much blood your heart pumps every beat. To find those, there are more advanced techniques and methods that doctors use for patients who have cardiac issues. What we are going to do is use a mathematical formula and a blood pressure cuff. It's not the most accurate way, but when it comes to monitoring to look for improvements, it is an effective way. To do this, to figure out your cardiac output using your blood pressure, you're going to use two different formulas. The first formula is to figure out your stroke volume. Your stroke volume is your pulse pressure divided by your systolic pressure plus your diastolic pressure. So the first thing you're going to do is you're going to take your blood pressure 5 times. You're going to take the average of those two numbers. Systolic is the top number, diastolic is the bottom number. To find your pulse pressure, you're going to subtract the bottom number from the top number. Then to find your stroke volume, you're going to divide that number by the top number plus the bottom number. I know it sounds confusing, but I'm going to go over it. So I took my heart, my pulse, my blood pressure, and what I came out with was a systolic pressure of 128 and a diastolic pressure of 75 and an average heart rate of 78. Based off of those numbers, my pulse pressure would be 128 minus 75, which is 53. My stroke volume would be 53 divided by 128 plus 75, which is 203. That gave me a 0.26. Now that I have that number, I can multiply that number by my average heart rate, which in this case was 78, and that's going to give me my cardiac output, which in this case is 20.28 milliliters. That is a little bit below average, but it's not anything that I'm worried about. And here's why. When I did my DNA testing, the results came back that I have an above average response to above average VO2 max response to exercise, a normal heart rate response to exercise, and a below average stroke volume response to exercise. Meaning that my body genetically has a better VO2 max capability than stroke volume capability. If you don't do the DNA testing, the only way to figure that out is to do a training program that we have here at Fight to Be Fit that basically tests all three things. It puts stress on all three systems. If you have a VO2 max response, an enhanced VO2 max response, then you're going to respond more to cardio training. If you have an enhanced heart rate response, you're going to respond more to HIIT training. If you have an enhanced stroke volume cardiac output response, you're going to respond better to a strength training program. So what we do is we put you for a month in a program that has all three aspects. At the beginning, we do the 3 tests. We train you for a month, and at the end, we do the 3 tests again, and we look to see which test improved. If one didn't improve and 2 improved, we drop what we were doing for the one that didn't improve, and we focus on the other 2 for the next month, and we see where they go. What this does is it helps you understand how to tailor your training to the best training program possible. But I'm going to tell you not to do this on your own. You want to find somebody who is trained to be able to administer these tests, to be able to look at the results and explain them to you in a way that you're going to understand, and administer the training program in a way that is actually effective. Once you have the training program done and you're going on it on your own, by all means, you don't need to stay with that person unless you have questions. But my recommendation is to find somebody. I would recommend an exercise physiologist, certified athletic trainer, or a personal trainer with certifications in strength conditioning and endurance training. If you can't find any of those, then I would say go talk to your physician and see if your physician has anybody that they can recommend you to. The biggest thing when you're starting a fitness journey is not to give up. And just because you don't see results using a program somebody else's doesn't mean that you're failing. It just means that that program isn't right for you. Now, here at Fight to Be Fit, we offer the DNA testing, but if you don't want to do that, if you think that that's not necessary, we also offer the body composition assessment, and we do the functional fitness test, which includes the VO2 max test, the heart rate, the target heart rate test, and the stroke volume cardiac output evaluation. If you're interested in finding out more about these, Fight to Be Fit Health and Rehab, 302-359-1890, fighttobefittrainingathletics.com. Follow us on YouTube at Fight to Be Fit Health and Rehab, or just come by and check us out, 773 Walker Road. All right, everybody, take it easy.